Welcome to Module 1 of Regenerative Orthopedics for Arthritis, a Signalome-based and voltage-guided approach. I'm your instructor for this groundbreaking course developed by the American Arthritis Foundation. For decades, we've been taught that osteoarthritis is simply wear and tear, a mechanical breakdown of cartilage from years of use. But what if I told you that this fundamental understanding is incomplete? Today, we're going to transform how you think about arthritis. By the end of this module, you'll understand osteoarthritis not as a structural failure, but as a communication breakdown, a signaling disease that can be measured, mapped, and most importantly, reversed. Section 1, the paradigm shift. Let's begin with a critical question. If osteoarthritis were truly just mechanical wear, why do we see such variation in disease progression? Why do some marathon runners maintain healthy cartilage into their 80s, while others develop severe arthritis with minimal activity? The answer lies in the molecular conversations happening within your patient's joints every second of every day. The joint is not a passive structure. It's a living, breathing communication network where cells constantly talk to each other through chemical signals. Chondrocytes, synoviocytes, and immune cells communicate through an intricate array of cytokines, growth factors, and genetic regulators. When this network maintains balance, joints remain healthy. When communication breaks down, degeneration begins. Section 2, Introducing the Signalome. This brings us to our central concept, the Signalome. The term Signalome, spelled S-I-G-N-A-L-O-M-E, represents the complete collection of all signaling networks operating within the joint microenvironment. Think of it this way, if individual signals are like musical notes, then the Signalome is the entire symphony. Every cytokine, every growth factor, every microRNA contributes to the overall harmony or discord within the joint. Within this Signalome, we have functional clusters called signal somes, S-O-M-E-S. Each signal some is a coordinated group of signaling molecules that work together to achieve a specific biological outcome. Section 3, Destructive Signal Somes. Let's examine the destructive signal somes that drive osteoarthritis progression. The first and most critical is the interleukin-1 beta nuclear factor kappa B signal some. When interleukin-1 beta binds to its receptor, it triggers a cascade through nuclear factor kappa B that upregulates matrix metalloproteinase 13, a disintegrin, and metalloproteinase with thrombospondin motifs 5, and cyclooxygenase 2. These are the molecular scissors that literally cut apart your patient's cartilage matrix. The tumor necrosis factor, alpha-C-Jun N-terminal kinase, signal some works in parallel, amplifying inflammation through interleukin-6 and intercellular adhesion molecule 1. Together, these create a self-perpetuating cycle of destruction. Other destructive signal somes include the ROS-NLRP3 signal some, driving oxidative stress, the VEGFFG signal some, causing abnormal blood vessel formation and pain, the transforming growth factor beta-3 SMAD proteins 1, 5, and 8 signal some, promoting fibrosis and bone spurs. The Wnt beta-Ct9 signal some, triggering abnormal bone formation. Section 4, Regenerative Signal Somes. But here's the crucial insight. The body also possesses powerful regenerative signal somes that can restore joint health when properly activated. The insulin-like growth factor 1, phosphoinositide 3 kinase, and protein kinase B-AKT signal some is your primary regenerative pathway. It activates SRY-box transcription factor 9, the master regulator of cartilage formation, and stimulates production of collagen type 2 and aggrecan, the building blocks of healthy cartilage. The transforming growth factor beta-SMAD proteins 2 and 3 signal some. Note this is different from the destructive SMAD proteins 1, 5, and 8 pathway, supports matrix synthesis and chondrocyte survival. The interleukin-10 signal transducer and activator of transcription 3. Signal some shifts inflammatory M1 macrophages to healing M2 phenotypes, literally changing the immune character of the joint from destructive to regenerative. At the genetic level, the microRNA 140SRY box transcription factor 9 signal some maintains the chondrocyte phenotype while suppressing destructive enzymes. Think of microRNAs as volume controls that can turn destructive genes down and regenerative genes up. Section 5, the balance model. In a healthy joint, destructive and regenerative signal somes exist in perfect balance. Some breakdown is necessary for tissue turnover, matched by equal regeneration. Osteoarthritis develops when this balance tips. Destructive signal somes become hyperactive while regenerative ones fall silent. the molecular conversation becomes a shouting match of inflammatory signals. Research from the American Arthritis Foundation shows this imbalance follows predictable patterns. In stage 1, interleukin-1 beta increases 5-fold. By stage 3, regenerative insulin-like growth factor 1 drops by 70%. The signalome progressively loses coherence. Section 6. Why traditional treatments fail. Now you understand why traditional treatments provide only temporary relief. Non-steroidal anti-inflammatory drugs block individual inflammatory signals, but don't restore signalome balance. Corticosteroid injections forcefully suppress all signal sums, both destructive and regenerative. This provides short-term relief, but actually impairs the joint's ability to heal itself. Even joint replacement doesn't address the underlying signaling dysfunction, which is why patients often develop arthritis in other joints. The Signalome approach is fundamentally different. Instead of suppressing symptoms, we restore communication. Instead of managing decline, we reactivate regeneration. Section 7. Clinical implications. What does this mean for your practice? First, it changes how you evaluate patients. Joint pain isn't just structural damage, it's a cry for help from a communication network in crisis. Second, it transforms your treatment options. You can now identify which specific signal sums are dysregulated and apply targeted biologics to restore balance. Third, it provides a roadmap for regeneration. By understanding the signalome, you can orchestrate a therapeutic symphony that reactivates the joint's natural healing capacity. Section 8. Key takeaways. Let's summarize the key concepts from this module. First, osteoarthritis is not mechanical wear and tear. It's a progressive signaling disorder characterized by signalome imbalance. Second, the signalome represents all signaling networks in the joint. Individual signal sums control specific outcomes like inflammation or regeneration. Third, successful treatment requires silencing destructive signal sums while reactivating regenerative ones to restore signalome coherence. Fourth, traditional treatments fail because they target symptoms, not the underlying communication breakdown. Section 9. Looking ahead. In Module 2, we'll explore how to map signalome dysfunction through immunohistochemical staging. You'll learn to identify specific cytokine and microRNA patterns that define each stage of osteoarthritis. Later modules will teach you how to apply this knowledge clinically using biologics like A2M, PRP, and PDPA to orchestrate signalome restoration, enhanced by bioelectric modulation. Congratulations on completing Module 1. You've taken the first step in mastering the signalome approach to regenerative orthopedics. Now let's test your understanding with a brief 5-question assessment. Remember, you need 80% or higher to proceed to Module 2. Question 1. Which inflammatory cytokine is the primary driver of the NF-kappa-B destructive signal sum in osteoarthritis? Is it A, interleukin-10, B, insulin-like growth factor 1, C, interleukin-1 beta, or D, transforming growth factor beta 2? Question 2. The TNF-alpha signaling pathway primarily activates which downstream kinase? Is it A, PI3K, B, JNK, C, STAT3, or D, SMAD2? Question 3. Which signal sum cluster is responsible for maintaining healthy cartilage production? Is it A, VGF-FGF signal sum, B, IGF-1, PI3, KAKT signal sum, C, WNT beta-catenin signal sum, or D, NLRP3 inflammasome signal sum? Question 4. The term signalome refers to what? Is it A, a single cytokine pathway, B, only inflammatory signals, C, the complete collection of all signaling networks in the joint, or D, mechanical stress sensors? Question 5. Why do traditional NSAID treatments fail to reverse osteoarthritis? Is it A, they're not strong enough, B, they only block individual signals without restoring signalome balance, C, they cause side effects, or D, they don't penetrate joint tissue? Excellent work. You've completed Module 1 and your quiz has been submitted. When you're ready, proceed to Module 2, where we'll explore the immunohistochemical stages of osteoarthritis. Thank you for joining us in revolutionizing arthritis treatment through the Signalome paradigm. Together, we're transforming osteoarthritis from an inevitable decline into a reversible signaling imbalance.